silicone breast implants will be available again after 14 years off the market. Now, the FDA banned them after many complaints of breakage or leakage and some worries that they might have contributed to disease. But recent studies really haven't shown a connection there. Now, 2 companies will start selling the implants. And joining me now, Dr. John Millard, a plastic surgeon out of Lone Tree, Colorado. Dr. Millard, thanks for coming. You're a plastic surgeon?
I am.
You're going to start putting in the silicone breast implants now, I take it?
We're going to start putting them in for primary breast augmentation.
And I know the big concern is the safety. That's why they were taken off the market 14 years ago. The FDA is putting them back on the market. How safe are they?
I think they're probably one of the safest medical devices out there. They've gone through extensive study in that 14-year interim period, and probably the most significantly studied medical device in U.S. history.
And during the break, we were talking a little bit about this. I think you brought up an excellent point. The fact that silicone is used for a lot of things in our bodies, knuckle replacements, joint replacements. So people have silicone in there. It's just for some reason the breast implants became a big issue a few years ago. They took them off the market. Now they're back. They're saying they're safe. You agree?
I agree. In fact, silicone's a material by which devices that are implanted into humans are compared as a standard for biocompatibility. So.
And now I know before this FDA ban was removed, only certain women could get the silicone breast implants. So if they had breast mastectomies, for cancer, they could get them. Who can get them now?
Essentially, for primary augmentation, if you're 22 years of age or older, everybody is, as long as they go through the process of informed consent, they understand what they're getting into. There's a 1, 3, and 10-year follow-up that's required by the patient, and then it's suggested that they get an MRI every 2 to 3 years.
And now this is essentially an ongoing study. The FDA is going to use it sort of an ongoing study to look at women who have breast implants, follow them at the time period you talked about, to make sure nothing goes wrong.
In fact, a mentor, for example, is going to submit their next 40,000 patients that the breast implants are put in, and they're expecting that to happen in the next 6 months to a year. So this will be continuing. The devices will actually be followed through the lifetime of the implant.
And I know you brought the 2 here to compare the 2. One, this is the saline implants. This is the one that's been around for 14 years, and the only one that women could use unless they had certain met certain criteria. And this is the silicone breast implant.
Correct.
And I mean, we were talking about this during the break. Just feeling them, they're completely different.
Absolutely. This has almost a hard, sort of unnatural feel to the patient and whoever else. And this implant actually, with its viscosity, feels much more like the natural female breast. In addition to, if you'll notice, you actually got rippling and scalloping up here on this implant, which you don't see as much on this implant. So the deformity you see on the patient after they have the implant is much less because it doesn't ripple as much.
And so the feel is more natural, obviously.
Feel and appearance are both more natural.
And now, I know one of the things, I'm pretty excited about this, you brought scissors and something to clean up the mess. You're going to show us the difference between leakage. That was a big issue 15 years ago, and one of the things that contributed to bringing them off the market was the fact that the silicone leaked. These obviously leak because they're saline.
Correct.
Show us the difference. Or show us what's going on.
This is a 5th-generation implant, and it's something called memory gel. And essentially, even if the implant ruptures, the 2 most significant concerns for a patient who gets breast implants are if they rupture inside the patient, where will the gel go? The other risk is for capsular contracture.
And what do you mean by 5th generation?
The implants were originally invented in 1962 and subsequently went through multiple stages of development and improvement, basically to improve the appearance in the patient and also to decrease leakage. As you can see here, even if the implant's completely cut in half, the memory gel will not allow this to escape to any significant degree. So even with this hard shell or soft hard shell cut, the gel stays in place.
And it's like I talk about on my show all the time. Everything has side effects. Everything has cautions you need to be wary of beforehand. I know with the silicone breast implants, the leakage is going to be an issue, and some of the reports are saying that over a lifetime, a woman with a silicone breast implant is probably going to need at least 1 additional surgery to correct anything. Do you agree with that?
I agree with that. As with any medical device that's placed in a patient, saline's the same way. In fact, there's some that think that the saline implants will require placement sooner than the gels just because they are a man-made device, and during the lifetime you can expect some sort of degradation and failure, and you just want to know that when it does fail that they're still relatively safe.
Okay, and you brought up the MRIs. They want women to get MRIs every
every 2 to 3 years.
And that's for?
That's to actually look and see it. The doctors themselves have about a 40% success rate to see if an implant, a gel implant's actually failed. The MRI has over an 80% chance of picking that up.
Okay. How about cost-wise between the two?
The cost is about $1,000 difference. Typically in the state of Colorado and Denver, you're going to pay about $6,000 to $7,000 for a breast augmentation with the saline implant. And for a silicone implant, you're going to pay about $7,000 to $8,000. So it's about a $1,000 difference.
Now I'm going to ask a very dumb question. $6,000 to $7,000, that's for both?
6 to 7 for both, correct.
Okay.
The entire operation.
Total. And again, anybody's eligible for it at this point. They're not restricting it to certain populations or certain people, assuming they've gone through you. And
well, as soon as they've gone through a surgeon that's been trained and they've gone through the informed consent process. And finally, silicone, interestingly enough, you have to be at least 22 years of age to get a primary augmentation because the FDA deems that is the time when the female breast is fully developed. You can actually get a saline implant when you're under 22.
Okay, so well, that's good to know as well. So in your opinion, these are safe?
I think, again, to emphasize, because of all the political controversy and everything else they've gone through, they have probably, not been a device, at least in the medical industry, that I believe has been more studied than the breast implant. And I would put them in my own wife, mother, and if I was a young woman myself, I would actually have them.
But you brought up a controversy. This is very controversial.
It has been.
And there's still people out there, the experts out there, in some form or another, that don't think this is appropriate, that it should be off the market still.
You know, throughout the world, both are a choice, and I think it's mostly political to be, in my opinion, I think there's risks with everything. And in this case, you know, again, leakage, back then it was related to lupus and some other body issues. All disproved. All disproved in studies. And short studies, long studies, big studies? Long, big studies. Mayo Clinic, Harvard, and then culminating in the National Academy of Sciences 400-page report in 1999. So they have completely disproven or put no connection to the autoimmune disease in breast